Hi, there is Dr. Arthur with you. In this video, I will tell you about such a disease as acne. You can consult me online. My contact details are listed in the video description.
Dietary restriction not shown to be beneficial in acne treatment, but small trial suggests low glycemic load diet may improve acne. Acne is not associated with poor hygiene and improper cleansing. Limited evidence to support or refute face washing for treatment of acne. Advise patient that improvement may take 4 to 8 weeks following treatment and acne may worsen during early treatment. First-line treatment is topical therapy with options of monotherapy with topical retinoid or topical benzoyl peroxide. Topical retinoids preferred for mostly comedonal acne, and include tretinoin, retin A, generic 0.025% to 0.1% once daily at bedtime. Adapalene, differin, generic 0.1% to 0.3% once daily at bedtime. Tazarotene, Tazarac 0.05% to 0.1% once daily in evening. Combination therapy, particularly if mixed inflammatory and non-inflammatory lesions, with topical antibiotic or topical retinoid plus benzoyl peroxide. Topical combination options include adapalene 0.1%, benzoyl peroxide 2.5%, epiduo gel once daily, adapalene 0.3% and benzoyl peroxide 2.5% gel, epiduo forte gel, tretinoin 0.025%, clindamycin 1.2%, Ziana or Veltin gel once daily in evening. Adapalene evening. Combination benzoyl peroxide plus topical clindamycin, topical 5% benzoyl peroxide plus topical antibiotic may be as effective as topical antibiotic plus topical retinoid in patients with mild to moderately severe acne. Topical erythromycin may be less effective than topical clindamycin, due to erythromycin resistance of Propionibacterium acnes. Addition of topical salicylic acid 0.5% to 2% commonly used for acne, but evidence for efficacy limited. For mild acne, alternative options include add topical retinoid or benzoyl peroxide if not currently using one. Consider a different retinoid. Consider topical dapsone 5% to 7.5%. Axone. Consider azelaic acid cream or sodium sulfacetamide lotion or wash, but evidence for efficacy limited. For moderate acne and acne with inadequate response to 2 to 3 months of topical therapy, add an oral tetracycline antibiotic to topical retinoid and benzoyl peroxide. Doxycycline or limacycline not available in United States, preferred over tetracycline or minocycline. Doxycycline dosing for acne for adults and children 8 years old and greater than 100 pounds 45.4 kilograms, 50 to 100 milligrams once or twice daily. Subantimicrobial dosing of doxycycline with 20 milligrams orally twice daily or 40 milligrams orally once daily may also be effective for moderate inflammatory acne. Limacycline 408 milligrams orally once daily, not available in United States, for patients greater than 12 years old. Consider azithromycin or erythromycin orally for patients who cannot use tetracyclines, such as in pregnancy or children less than 8 years old, but limit erythromycin use due to increased risk of bacterial resistance. Macrolides, azithromycin and erythromycin, not FDA approved for acne. Erythromycin dosing 250 to 500 milligrams orally twice daily, azithromycin dosing 500 milligrams orally 3 times per week used in trials. Avoid use of oral antibiotic as monotherapy. For alternative treatment, consider different combination topical therapy, triple topical with retinoid, benzoyl peroxide and topical antibiotic, or different oral antibiotic. For severe acne or acne with inadequate response to 2 to 3 months of oral antibiotic plus topical therapy, options include FDA-approved oral contraceptives. For moderate acne vulgaris include ethinyl estradiol (EE) 35 mcg plus norgestimate 180 mcg, 215 mcg, or 250 mcg, EE 20 mcg, 30 mcg, and 35 mcg plus norethindrone acetate 1 mg plus ferrous fumarate, EE 20 mcg plus drospirenone 3 mg, EE 20 mcg plus drospirenone 3 mg plus levomethylates 0.451 mg. Spironolactone not FDA approved for use in acne. Spironolactone spironolactone 50 to 100 mg orally daily for 6 to 12 months advised for acne. For men or women with severe acne, oral isotretinoin. Contraindicated in pregnancy. For women, contraception and monthly urine or serum beta-human chorionic gonadotropin (HCG) testing required. Consider baseline and ongoing monitoring of liver function tests, serum cholesterol, triglycerides, and symptoms of mood change or anxiety. Isotretinoin dosing, patients 12 years old. For moderate acne in adolescents and for adults, isotretinoin 0.5 to 1 mg per kilogram per day orally in divided doses. For moderate acne in adolescents, isotretinoin 0.3 to 0.5 mg per kilogram per day, cumulative dose goal of 125 to 150 mg per kilogram. Avoid oral isotretinoin in conjunction with oral tetracyclines. Light-based therapies have insufficient data to determine role in therapy. Blue light and/or red light might improve acne. Pulsed dye laser appears effective as a monotherapy for reducing lesion counts in facial acne, but pulsed dye laser therapy may not increase efficacy when added to topical medication therapy for acne. Photodynamic therapy may be more effective than light therapy alone. Write comments and questions under the video. Subscribe to my channel.